As we think about what's next in health and medicine, we can sort of look at what's moving quickly around us already. Things like generative AI already having huge applications in healthcare, from being able to help you do your own self-diagnosis to having the doctor-patient relationship charted and saving time and stress and burnout. But I think we're kind of heading with all of this in this era of hyper-personalization and big data from all these sorts of new forms of digital twins and beyond. It's not generative AI, but generative health. So imagine each of us has our own truly personalized health sort of avatar that relates to us based on our age, our culture, our language, our incentives, your favorite color. Because today, a lot of the way we get health information and data and apps and user interfaces are pretty one size fits all. So we're entering this era, I think, of what I call generative health. We'll all have our own highly personalized chatbot, health coach, personalized AI clinician, even that knows what we did last summer, knows what our genome is, knows that when you're riding on an airplane, that's probably not the best time to remind you to take your walk, and to keep you engaged in your health as your journey guided to where you want to be and your destination, and to leverage the crowdsourced knowledge of the world to keep informing that generative health engine so we can improve health and medicine for all of us across the planet. Hi, I'm Dr. Daniel Kraft. I'm a physician, scientist, entrepreneur, investor, innovator, founder and chair of NextMed Health and Digital Dot Health. And I'm excited to be a speaker at the EXO Exponential Executive Program, particularly because so much of the future of health and medicine is riding the convergence of exponential technologies, from AI and robotics and 3D printing and nanotech and generative AI to CRISPR and synthetic biology to psychedelics, all coming together, giving us an opportunity to rethink and reimagine healthcare for ourselves, our friends, our family, our communities. I think the most exciting thing coming to the future of health and medicine isn't any one big breakthrough or development. It's how they converge and super converge. Now we're in the age of magical AI, merging with big data, merging with wearables and low-cost genomics and synthetic biology. And so all those are moving very quickly. And thematically, the EXO, when you connect the dots between those, you get a whole new set of possibilities. So example, I'm a physician. Most of how we practice healthcare today is really sick care. We sort of wait for disease to happen. We get small snippets of data, usually collected in the four walls of a clinic or, God forbid, the emergency room or intensive care unit. And from that, we practice reactive medicine. We wait for the patient to show up with a heart attack, stroke, or late-stage cancer. And I think what's most exciting is a bit of a breakthrough now is the opening of the dam of data to turn into insights and knowledge, and that knowledge can translate to the bedside or the website, or for you, the individual, the consumer, the patient, into doing more self-care and moving the needle from reactive sick care to proactive true healthcare. So that's a bit of a big picture landscape. And what it opens up is this new opportunity for all of us to be more involved in our own health and medicine. The new drug is the empowered patient, the empowered you. And now I'm wearing 4 different wearables: my Apple Watch, Oura Ring, Ultra Human Wing, a Whoop. I'm kind of comparing them all. They're aspirationally the same. But now they don't just give you your steps and maybe your overall sleep. They give you maybe integrated sleep score, stress score. They give you a bit of a dashboard if your temperature's off or your heart rate variability is off. Maybe you have early COVID and you might want to isolate or check your temperature. Or maybe it notices that your heart rate is 120 when you're sitting down doing an interview. So those things might be clues that you need to be a little bit proactive and sometimes diagnose a challenge or problem earlier, or use that information to optimize your prevention and your health span. So 3D printing can also match and integrate with the field of regenerative medicine and stem cell biology, where instead of printing with ink, you print with stem cells or progenitors, sometimes combined with bioengineering. So you can engineer a new blood vessel or potentially a small microorgan. There have been several companies that have been able to sort of 3D print microorgans like parts of kidneys and livers, and using those to screen for different drugs or look at the impact of different stem cells with underlying disease. We're not quite yet at the era of being able to 3D print a fully personalized organ that you could put back into a patient. And that might be even disrupted by this new convergence, the super convergence of CRISPR and genetic engineering, where we're able to humanize a pig. Pigs are about human size. Their organs are about human size. And we've seen in the news in the last couple of years, the ability to humanize a pig, meaning knocking out some of the pig genes, knocking in some human immunologic genes. So that organ can be transplanted to a human and survive inside that human patient. We've seen examples of that now with kidneys and the first heart transplants, which the patients have survived for a couple of months at max. But it's still very early days because 3D printing a complex internal organ is still not quite here, but I think we'll see elements of that in the not so distant future as well. Health and medicine is ripe for many changes across the care continuum, from prevention to diagnostics to therapy to public health to global health. The challenge today is a lot of our interventions are very much one size fits all. There's no average patient, but our clinical trials are driven to sort of the mean, and most of us live somewhere to the right or the left of average. And in fact, I hate to break it to you, but 50% of doctors and nurses and pharmacists are below average. So I think the potential for some of these emerging technologies is to upskill all of us. If we're doing our own self-care and self-diagnostics, or if I'm a clinician and I'm seeing you as a patient, I should be able to use the crowdsourced knowledge of the world to do a better job at using the data about you to figure out what's going on, both to optimize your health, to find a problem early, or to pick the right therapy. So let's start with, let's say, diagnostics. Again, a lot of diseases are picked up late, often because patients aren't symptomatic until the disease has progressed pretty far. Now with the ability to take and sniff out some of these digital biomarkers, maybe from our Internet of Things, how your Wi-Fi in your house picks up changes in your gait or changes in your voice, or being able to scan the back of your retina with your smartphone attachment and it looks at the back of the eyeball, which is a bit of unleashing a whole set of new predictive analytics, including risk for disease and whether you have a challenging element. We now have the ability to look at lots of omics, your genome, your proteome, your metabolomics, and put those together in interesting ways. So instead of just being a type 2 diabetic, we know what exact subtype you are and how best to both diagnose, stratify, and treat you, so that we're not treating everyone with the same type 2 diagnostics or therapeutics. And I'm excited as a clinician to use these tools, to speed up and give earlier intervention, and also to end up with better outcomes at lower costs, and to democratize some of these tools for prevention, diagnostics, and therapy around the planet. And so I think at this executive program, you're going to have your brains rewired across multiple fields and apply them not just to health of yourself and your family and your organizations, but to thinking differently about the art of the possible and creating a better future for all of us.